Guys, thanks for tuning in to my channel. Today I'm Michelle, and I had a vertical sleeve gastrectomy on September the 3rd of 2019, and I have gained quite a bit of weight during this quarantine, so I'm pretty frustrated today, but I did want to get on and make a video and just check in and see how everybody's doing during this pandemic, because it has been hard. I had originally gained 8 pounds over the last month and a half, and I just weighed myself, and it is now 10 pounds. So I'm super frustrated. I have been cooking at home, which is something that I normally don't do a lot of. I'm not a good cook, and I don't enjoy cooking in the kitchen, but the things that I know how to make are the things that our parents made for us when we were kids. So a lot of home cooking, chicken and dumplings, things like that that are just full of carbs that I know better than to eat and know better than to have in the house. And there has been sugar in the house. So there's been a lot of snacking going on. I am stress eating. I'm a nurse. I don't work on the floor. I'm super grateful to not be in labor and delivery or in trauma or in the emergency room. I've been home for many, many years. I work for a big insurance company, and we've had a lot of stressful things happening at work and rewriting of policies and things to make sure that people can go and get what they need during this if they're sick, or they can have their co-pays and co-insurances waived, things like that. So it has been stressful, and just being trapped in the house. Today I've just got to start getting out of the house and going to walk and get some fresh air, because that hasn't been happening either. I'm not moving my body. I feel just blah. And there's just so much. I'm an empath. I think I've done that in a video before. So I absorb people's feelings around me and energy. And during this, that's not fun. So my stress level is through the roof, and that's no excuse to be eating and eating things that I know that I shouldn't be eating. But I can tell you that I've caught myself reverting back to old behaviors, and it stops today. I've got to do a mini reset and get my weight back under control, because it came on so quickly in the course of like a month and a half that my mind was blown when I stepped on the scale this morning. I have a hate relationship with the scale anyway. It never tells me anything good. So, I was just a few pounds away from Wonderland, and now I'm back up 20 pounds away almost from Wonderland. So I'm just really frustrated, and I'm sure that you guys are going through challenges too. But to just see how quickly this weight has gotten back on me, I'm disappointed in myself. I'm disappointed that I haven't done better, and I'm beating myself up, and I'm just gonna have to stop doing that. So today is mini reset back to protein shakes 3 times a day. So that's just what I'm gonna have to do to be able to get this weight off and continue to be successful with this surgery during a pandemic, which none of us expected to happen. I was gonna do what I eat in a day on YouTube, and right now that's probably not a good idea. You guys don't want to see the snacking that I've been doing, and that's my biggest issue right now, is the snacks in the house. I've stocked up for a teenager. I wasn't doing that before, and now they're here, and I have zero self-control when it comes to that kind of stuff. So ice cream, sweets, fruit roll-ups, snacks, chips, all the things that were my downfall before, I have put in this house, and it's just gonna have to be taken out. That's the only thing I can think of. My teenager's just gonna have to understand that we're not gonna have that stuff in the house, and that there needs to be healthy foods here, and we both need to get out and walk every day. We need to be out in the fresh air. We need to be out getting vitamin D because I'm already low in my vitamin D as it is, and I have prescription strength vitamin D that I take. I'm just going to have to change behaviors. And if you're also struggling, please let me know. It's kind of nice to know that I'm not alone, because I feel like a failure right now. I've got this tool, and yeah, I paid a lot of money for it out of pocket, and I've gained all this weight. Yeah, it's not 70 pounds like what I lost, but 10 pounds, 12 pounds is a big deal. Like, my clothes are fitting differently, and I could feel it. I hadn't weighed myself until today, so I was shocked and disappointed. So, reset happens. If you guys have any resources for resetting, let me know in the comments below. Please subscribe, turn your notifications on. It has been a challenging time trying to get these videos up. I've got to do a better job of doing this once a week, or else I'm not going to build, a group of people that I'm going to help to be able to influence. But I don't want to come on here and just be all happy and excited and not let you guys know that I've gained weight, because that's not being honest. And that was something that I committed to do when I started this channel, is letting you guys know all the struggles that I'm going through, and gaining weight is one of those struggles. And it's really, really hard, because I had been so happy with my weight loss and how I was doing, and then this happened, and feeling like I'm trapped in the house, and stress eating and being bored and eating. I don't want to stretch this pouch out, and I feel like I've been eating larger meals than I was doing before. So it's just time. It's the best time that I can think of to just reset and start over with protein and liquids and only healthy things. So I've got to get this stuff out of the house, and the next grocery trip is going to be totally different than the last one, I can assure you. You guys, please stay home. Being a nurse, I can tell you, this is nothing like I've ever seen before. I'm at 27 years of being an RN, and I've seen SARS, and I've seen MERS, and I've seen H1N1, and seen a lot of things, but just what I'm hearing and what I'm seeing from nurses and doctors on the front lines, this isn't like anything we've ever seen before. There's no cure. And all that the people at the hospitals can do is just support the body, being on ventilators, and there's no antibiotic, there's no drug that can be given to make people better. We can control the pneumonia, which is the biggest thing that kills people, is getting pneumonia and sepsis that goes along with these respiratory issues. But there is no medication or quick fix for this. So please social distance. Please take this seriously. Please stay home and keep your families safe. For those of you that are nurses and doctors, paramedics, EMTs, CNAs, those of you that are working on the front lines, thank you. Thank you so much for everything that you're doing. I know it's hard. I know it's hard to see, and it's terrifying. It's scary to think that you could bring that home to your family. So please social distance. Please follow the orders that people are giving you to stay home. Please pray for our country. Pray for other countries. Please pray that we can get a handle on this and figure out what needs to be done. When you hear flatten the curve, that's the only way. Containment is the only way to do what needs to be done to get this under control. And by containment, I mean stay home. Flattening the curve, if you don't understand what that is taking the overload off of the healthcare system, and having less sick people show up at the hospital. Do not go to the hospital if you're not experiencing symptoms for this. Do not go if you don't have a fever. Do not go if you're not having trouble breathing. I can't stress that enough, is you don't want to be in the hospital right now if you're truly not experiencing those symptoms, because you could pick this up. You could pick this up at Walmart. It's very scary. It's airborne. Dr. Vuong, who is a bariatric surgeon, if you're not following him, you need to. Duc Vuong, V-U-O-N-G. He has a great YouTube, and he has gone viral with his information about this situation, and I had already followed him before, being a bariatric surgery patient. But if you're not following him, please go over and listen to what he's telling you about washing your hands and doing the things that you need to do to stay safe. So stay in, guys, stay home, eat right. I gotta follow my own instructions on that because I've not been doing it, and my body has shown it in weight gain, so it's pretty depressing. But I'll be okay. I can get it under control. I know what I need to do. So hopefully by the time I do the next couple of videos, I'll have my weight back down and under control, and I'm still pushing toward Wonderland. So subscribe below, you guys. Turn your notifications on. I'm doing my best to get videos up to try and post about what's going on, but there have just been so many other things more important than posting YouTube videos in my life. It's been really challenging. So my Instagram is gastric sleeved superwoman. You can find me over there. It's gastric_sleeved ed_woman. I've gotten a nice little following going on over there, and I do post more regularly to Instagram than I do here on YouTube. But I just wanted to hop on for a second and just check in with you guys, make sure everybody's doing okay, let you know that this weight gain has just thrown me for a loop, and I've got some changes that I'm gonna have to make starting right now. So subscribe, turn your notifications on, you guys. Stay safe, stay home, flatten the curve. Talk to y'all soon.